got all kinds of great video and therapy. We haven't looked at this knee in the office since the 12 days from surgery, so how's it going?
Good.
How's it feel?
Good. Can't wait to play ball.
Stable? Does it feel more stable?
Yeah.
Did it ever feel unstable?
It felt a little unstable, and when you're walking and you're kind of trying to, get your feel, you could feel your leg, or maybe it's your imagination, you feel like your leg's slipping out, But, I mean, I was off the crutches and everything else like 3 or 4 days out.
Well, scoot back a little bit, and then I want you just to, when I want to zoom in or come in a little bit, that'd be helpful. It looks like it's relax your muscle there. Part of the therapy in one of the shots that we saw with Travis is Travis was doing some scar massage that lets the tissue and the skin above the graft site separate and loosen up. And so this looks like the scar is doing real well. The incision's real small. You can't even see the arthroscopy portals, and hair is actually growing. So that looks real good. I'll have you lay back.
Are you saying I should be seeing somebody for a wax?
No, let it grow.
All right.
It's all good. Let me have you lay back. You're always adding to it, okay? So we're going to look at Steve's knee here, and he just pops it upright, of course, right away. But let's look at it straight. Do you feel like it can lock out? Feels real good. You're real flat there. Much better than the video we shot there. And then with your knee relaxed, and let your other foot drop down. Get this rubber band off my hand. Relax, and at about a 30-degree of flexion, we do a test called the Lockman test, and this is a test to check for stability. When people have a tear, the shin bone or the tibia slides forward. And of course, after surgery, it better not move too much, and his feels real stable. A second test we do at about a 90-degree angle, called the anterior drawer. You relax your hamstring there. This is very stable. And a person who sees me before surgery, when I try to slide the shin bone forward, it really moves. So this feels real good. So the stability of your ACL is solid. How about your bend? Where are you now? Okay. Wow. I don't think my measuring device even goes that far. I've got 135 degrees of flexion. Now, what day was your surgery?
February 12th.
February 12th?
Yep.
How many days does that make us?
Well, I'm 6 weeks to the day.
6 weeks. 1, 2, 3, 4, 5, 6 weeks and 1 day. So this is great. 6 weeks post-op. They're probably going to have you start to do some jogging or walking on the treadmill. Are you doing that yet?
I've been doing 15 minutes of Stairmaster, 15 minutes of bike, 10 of it sprint. And today I did, what's that thing? The thing where you're running but you're not running. What is that thing called? You're doing your thing with your arms.
Elliptical?
Yes, thank you.
Okay, I thought, there's lots of things with that.
I did 10 minutes of that.
Okay, so what they're going to work on is they're going to work on getting the last bit of bend. You're pretty close to full bend, and now they're going to transition to strengthening. And we're going to watch this thigh muscle that actually looks pretty good. Oh, there you go, you tightened it up. We're going to watch that one get back to the size. And if you come in here just a little closer with the video, you can actually see that this left quad muscle is just, huge. And this one is okay. I'm trying not to be mean.
6 weeks.
But what we're going to watch in the way that these ACLs rehab to give you a good result is when this thigh muscle and the hamstring muscle strengthen up. Okay. So the next phase will be transitioning to more strengthening, and then in a little while more sports-specific rehabilitation. But this looks great.
I'd be further actually with my bend, but I've got a little bit of swelling still here, and the bone, when I heard it initially, these bones were jacked up, not to be too technical, and they're still bruised. I mean, it still hurts.
It takes time.
Yeah. So, but if this little bit of swelling is almost gone.
Well, a lot of research does show that the injury and the inflammation with the injury, and then the trauma with surgery are like a double whammy, and it takes time for all your soft tissues to recover from your injury trauma and your surgical trauma. And so this is all, as long as you're hitting landmarks with motion and strength, the rest will just calm down with time.
And my calf muscles getting there.
Okay, all right then. There we are.